A new mystery illness has been infecting children, and researchers believe it might be linked to COVID-19. We spoke with Dr. Beck from WesTex Urgent Care about the illness to learn what exactly pediatric multi-system inflammatory syndrome is.
The syndrome that is being reported in a small amount, it's not a high percentage. The syndrome that, as you're referring to, that's being reported in a small amount of children that have had COVID-19 is very similar to Kawasaki's disease. Kawasaki's disease is a syndrome that is more common in children less than 5, and it can be characterized by various things, including fever and a rash, especially like in the on the torso and on the face, on the palms and the soles of the feet. The big deal with Kawasaki disease is that it can sometimes be associated with aneurysms forming in the arteries in the heart, the coronary arteries. And that's why children that are diagnosed with Kawasaki's disease typically need to see a pediatric cardiologist, and there are some specific recommendations for treatment on those, including IV gamma globulin or immunoglobulins that can be used to treat Kawasaki disease. So the syndrome that we're seeing right now is very similar. Well, we don't think it's the same thing, and what we have noticed too is not necessarily inflammation of or increased risk of aneurysm in the coronary arteries in these children, as much as we're seeing some inflammation of the heart itself or the heart muscle.
And doctors are still learning about the illness, but it does seem to be affecting an older range than the Kawasaki disease.
We're seeing it in some teenagers and typically, children that are over 5 years of age. So it's out there. We're learning more about it, but it's only in a very small percentage of the children that actually have COVID-19.
And while we haven't seen any cases locally, Dr. Beck says it's still something to look out for. The symptoms for both of these diseases are pretty similar.
Well, if your child did was diagnosed with COVID-19 or there was a suspicion for COVID-19, the symptoms of Kawasaki's disease can, like I said, include high fever, a rash. It can be anywhere on the body, but specifically, we don't see very many rashes that affect the palms of the hands or the soles of the feet. So that's some of the symptoms that you might experience, as well as what we call like a strawberry tongue, where the tongue is very red and sometimes inflamed. Those are the main symptoms. And also with the PMIS that we're seeing associated with COVID-19, there tends to be more children with GI symptoms that we don't see in Kawasaki's disease, things such as abdominal pain, nausea, vomiting, and diarrhea.
And if you start noticing any of these symptoms, you should call your doctor immediately, because both illnesses require specific treatment.
If you have concerns that your child may have Kawasaki disease or PMIS in this case after COVID-19, then please contact your healthcare provider, because they do need some special follow-up that is not part of the normal follow-up for just coronavirus. Like I said, these children that have Kawasaki disease or PMIS may need an ultrasound or an echocardiogram of their heart to look at either their heart or the coronary arteries to look for aneurysms or enlargement or inflammation of the heart itself. Again, and I did mention that it's in by far the minority. It's a very low incidence. It's out there, but it's not common at all.
WesTex Urgent Care is still offering testing for COVID-19 and also for the presence of antibodies. If you're interested, please visit WesTexUrgentCare.com to make an appointment. They have locations in Midland and Odessa.